I'm important and I deserve to be treated fairly and not look.
This this really hurts me. It pains my heart. It truly hurts my soul that this young woman who is in the midst of a crisis, a sickle cell crisis, I believe. She's in the ER and she purposefully folds her shirt and places it on the bedside table next to her purse, and in a way so that when the doctors and nurses first enter the room, they see her work shirt and her purse, because she also has propped her arm with her blood pressure cuff and whatnot over it so that her hand is sitting on the work shirt. This young woman has framed her work shirt, okay, like the fight scene in a damn Marvel movie, all so that she can guarantee that the people taking care of her know, quote, who she is, so that they know she's somebody important and is deserving of their care. The things that we go through, the crap that we go through, just so we can get the most basic of medical care as Black people in our own country, is so far from ridiculous and inhumane and embarrassing on the part of you healthcare workers, that as patients we have to go through all of this just just because we know that the great majority of you are operating on conscious bias, discrimination, and all of that. And those of you who aren't, you're operating on autopilot and you can't be bothered to treat every patient as an individual. And then the rest of you who think you're doing an amazing job because you only see patients. You don't see a diagnosis. You don't see an orientation. You don't see skin color. Y'all think that you're doing an amazing job when you operating on the unconscious bias, which at times hurts us more than those who are just flat out being discriminatory. Because at least with them, we know what we're dealing with. What we as sickle cell patients and chronic pain patients go through just in an attempt to access care, which is in our right to have as citizens of this country, and people who have been diagnosed with a disease and medical problems, is on par with all of the crazy things that women do just to not be put in a situation where they could be physically violated or robbed or kidnapped. Going out of our way just to do simple things like walk from our office to our car at night, which we should be able to do without problems. And as a patient, we should be able to go to an ER in whatever we're wearing, state our medical issue, and have it taken care of without the fear of running into some doctor or some nurse who will decide just by looking at us whether or not we're actually in need of their care, whether or not we are worthy of their kindness, empathy, compassion, and medical expertise, whether or not we deserve to be in that bed, in that room, or if we should be criminally trespassed because, we refuse to put on a show of crying and yelling and breaking down so that we can meet your false standard and vision of what somebody who is sick and in pain and is in need of your medical expertise should look like. Because heaven forbid you walk into an ER, know your diagnoses, know what's going on with your body, know exactly what kind of care you need, how much and how often, and can break down the why of it backwards, forwards, up, down, all the way around. And yet, that combined with our decades of medical records is never enough. And when you all get backed into a corner, you turn into the most cowardly of people, where you say things like, I'm not comfortable and I'm not risking my license, knowing that there is no way that your license will be of risk if you follow a care plan of a patient born into an illness, a care plan they've been following for 20 years without any problems. You know you are not in any type of danger of having your livelihood stripped from you. And yet, because you're a coward, because for some reason you've decided that it's better to sacrifice your patient than to stand up for what's right, you say you're uncomfortable. You gaslight us. You send us home worse than when we got there. And then you have the nerve and audacity to talk about how you feel bad for us. Nerve and audacity to tell our families you did all you could. There's no reason why this young woman should have to physically put her work shirt out so that it can be seen, so that she can be considered more valuable and therefore worthy of care. Ridiculous.